5 at the Fishers Community Center. All right, we have a quorum. Motion to approve the prior minutes. Motion. Second. All in favor? Aye. Okay, that motion passes. And I guess we're on to the monthly board reports. Is that right?
Yes.
Right. Motion. We have to do motions on that too. Motion to start the monthly.
Yeah, you can to approve. We don't, you're not.
Oh, it was the consent agenda, right?
Yeah, I can't advance this. Where's my
Hey,
IT
Chris,
support?
'cause it was on the consent agenda, so it's part of it. Yeah, it's the other consent.
Yeah. I'm gonna motion to suspend Robert's rules for tenants.
What's your sales rules?
Styles.
It's free. Yeah, so, we'll just note in the minutes that B is not under the consent agenda. That'll be pulled out into the regular agenda, right? Your monthly reports, are you trying to?
Yeah.
Right?
Yes.
That'll be the first item.
Just doing this. I have it downloaded.
I'm here for the tour.
Got you.
Okay, so just temporary troubleshooting. So I can start on the first item, which is really just a reminder that we meet according to the state rules, that we meet every January, April, July, and October. What our traditional schedule has been is the fourth Thursday at 11 of those months. Does anybody have any preference about moving that regular meeting time for 2026? Since this will be our last meeting in 2025, unless we call a special meeting. Does anybody like this time or want to propose a different time? It's working for all of you that are here.
Kind of hard to ask, yeah.
No, I think we're, I guess there's no one really, it's 2026. I guess we just keep it at that.
Keep it at that? Okay, so we can get those scheduled out for you and block your calendars for it. And I think the intention of having the meeting today here was to just get you guys a look at the space, but I think they'll probably continue to be at City Hall after this. Unless you want to vote otherwise. I don't know if we need a vote on location of the meeting.
That's one that's more.
We don't have quite as many tools for public meetings in this space as we have set up as a standard at City Hall, so.
Yes,
Probably City Hall going forward for 26.
so I motion to move and have the meetings on the fourth Thursday at 11 a.m. quarterly, starting in January 2026. That makes sense?
Sounds great.
All right, do I have?
We'll block the schedules if the board
we have
agrees.
to vote on that?
Sure, yeah.
Second.
Vote? Ayes?
Aye.
No? Okay. The ayes have it and we're set with that schedule. So we'll catch up to speed here. We approved the previous minutes
Okay.
and we just voted to have the meetings quarterly on the fourth Thursday at 11 a.m. On the quarterly, starting in January.
The
We're
same that
keeping
we've
the
been
same
doing.
The same we've been doing,
Yes.
Right.
essentially. Okay. All right.
Okay.
Proceed.
This is us.
Now we're on,
Okay, so that's what we just did. So here's the agenda. Like we talked about last time, we're gonna talk about a couple of fee schedule changes that we're hoping to propose to council on Monday, if you all support them. And then we'll just give you very brief updates on operations and strategy. And then again, for your discussion or review, our 2026 priorities, since this is the last time we're meeting in 2025 and we're formulating those now. And then we'll take a tour of the community center. So just to review, this is our 2025 priorities that we had set in that hopeful time when we had lots of funding from Health First Indiana. The time is not this time. So you'll see our priorities are shifting a little bit, but we're still moving forward the same projects and still trying to push forward in a lot of the same areas. So I'll let Laura talk about general finances.
Yep, this slide represents, just to give the board an update on the 2025 revenue and expense. And our on the operating side, which again is revenue from fees and services. And as you can see for the budget for the year, we were budgeted to bring in 260,000. And right now, so far as of September 30th, we brought in a little over 469,000. And then on the expense side, for operating, we are trending a little on the high with 83% spent. Our original budget was 1.8 million. Again, just more expense on the vaccine side. So we're really focusing on vaccine purchase and personnel payroll expense. And then for HFI, we're about 60% spent, which you'd want to be around 75%. So we're under, which is great because we're planning on rolling over 310,000 for 2026. Next slide is our 2026 budget. Just kind of review what we requested. The 2026 budget is in the orange. And then if you compare it to 2025, for operating, which does not include payroll, we requested a little over 636,000. And then if you look at what we had in 2025, the total between operating and HFI was about 932,000. So obviously, we expected that there would be a decrease. IT, BSG, and the community center are covering some of the operational expenses. And then our HFI budget, which is 517,000, is all allocated to salary and benefits. Any questions on finances for those 2 years? And then as far as the clinic update, just as a reminder, in 2024, our clinic revenue was about 77,000. So far this year, we've taken in a little over 270,000. So you'll see that increase, and you could see the trend like each month. We had a huge spike in August due to a lot to our back to school vaccines. We had extra pop-up clinics for those. So extremely busy during that time. And then we have a accounts receivable of about 40,000 still to receive in so far. And as far as the clinic recapture, our goal for the year was to be at 50%. You can see that we are meeting that. In August, we were at 76%. And so again, that's looking at our expenses from staff time, supplies, vaccines, does not include facility expenses. And then the revenue that we brought in, we're able to recapture 76% in August, down a little bit in September at 63%, as demand kind of decreased somewhat. Again, talking August, back to school clinic, and we also had some denial claims that were reprocessed that we received some money in. And we had a little bit higher labor costs in September for the additional pop-up clinics that are now starting for flu season. Any questions? Nope. Guess it's still me. Contracts and grants. So right now we have not applied for any other new grants. We're still searching for grants, and our priorities will obviously be determined by the community health assessment. And then we're also considering focusing on maternal and child health and chronic disease prevention grants. We funded for 2025 Shepherd's Community Center of Hamilton County, and then the Hamilton and Southeastern Foundation Project Hope, which is the mental health counseling provided in schools. We'll have more of an update in January. They report semi-annually. So, and then we have had some movement on our school health club grants. We awarded one to do the Fishers Junior High Yoga and Resiliency Club for $500. And then we're considering a grant with HSC High School for the Red Ribbon Week. And they requested $500. We still have about 7,000 remaining. So plenty of opportunity for more grants with the schools. This slide is looking at our vital records. So we talked about this last meeting. You can see we've had quite an increase in revenue from last time. Most of it's due to our increase in multi-decedent requests. We brought in over 85,000 through the end of September. And Barb has been extremely busy. But obviously we will probably be close to like funding that position with overhead for the year.
So this is, we really put in, this is the same slide you guys saw last board meeting. That red line would be sustainability line of like fully funding, like the work fully funding the position. We are bringing a little bit more revenue now because the multi-decedent requests, we have no idea if that will continue. There are still some questions, I think, at the state level, as far as how that program is administered with the vital records now being available statewide. But for the minute, it's resulted in increased work and increased revenue for us. But this is just was a reminder to prep for the first question for you guys to discuss. Our proposal, I know we discussed not really raising fees on birth and death certificates at this time, but there is a coroner continuing education fee that is required when you issue a certificate for death. So that goes into a fund at the state level that then supports the coroners to get educated. So it's in the Indiana code. And one of the changes that's happened is that they've updated that code, and the code now has sort of a graded amount. So for, years, I don't have them handy, but like from 2024 to 2028 or something, the fee is $2.50. And then after 28, it goes up to like $2.75 per certificate that's issued. So what we would like to propose is just keeping all of our birth and death certificate fees the same, but adding the coroner's education fee on top of the death certificate fee instead of inclusive to it, since that's a graded increase and just increased transparency of what those fees are.
Of a net gain of $15 per.
It would
stay the same, right? We'd still get the 15. You just
we
wouldn't
still get
have
the
to pay
15. We wouldn't have to carve out the 250. It would just be,
Separate.
it would be on top of, kind of like we,
1750 essentially. is what
yeah,
you
kind of
charge
like
them.
we add like credit card fees
Yeah.
on top, right? Like, so you'd see, okay, death certificate fee, $15, coroner's education fee, $2.50. But if we change it, we can tag it to the Indiana code so that it automatically increases as the code increases instead of having it hard coded in our fee schedule and having to go back each time. Open for discussion.
It's a great way to manage it, 'cause then you don't have to come to us
Right.
constantly every year.
Right.
And Hamilton County has recently done that. So, and I think other jurisdictions around the state are probably looking to do the same, just.
And Monica, you'd show it that way too.
Mhm.
Like they would see it, $15
Yep.
for the death certificate
Yep.
fee, $2.50.
Yep.
Because I think that shows that then it's not us
Yes.
increasing, this was assessed.
Yes.
Because of the
Yes.
Indiana code.
Yep.
So that's transparent to people. If you have a problem with it, go change the code.
So you say that.
So the motion would be to separate the Fisher's fee and the, was it coroner's education?
Uh-huh.
And just keep those separate.
Yeah.
And move
But-
forward with whatever the fee schedule changes.
Yeah. It would just be to support our move to do that. And then we still have to take it to city council for kind of official adoption in the municipal ordinance.
Do we have to vote on that? I think it'd be nice to get your recommendation for the council.
Make the motion.
Second. All right, all in favor, say aye.
Aye.
Those against? No. Well, it looks like the ayes have it. Okay, passes.
Great.
You're doing good over there.
Sounds good to hang of it, man.
Oh,
Okay.
that's it.
It's in the groove.
Can't mess him up.
This magical seat here. Oh, you're too close.
So now we come to the kind of the biggest part of discussion. So this slide that you're looking at now, and this is where your little packet starts because it's just as really with the food permit, because this is kind of the largest complex fee schedule that we have. So this slide is the same one that you saw last time. Again, that red line is a sustainability line. So where the positions and the work is self-funded essentially. So you can see that we're well under that line currently. And what I heard from the last meeting, and anybody correct me if I'm wrong, but I heard a direction from the board that if we're going to move on any fees, it really should be the food operators, so that program is more close to sustainability. So this slide, just a reminder of where those fees are at. We have temporary food establishments, we have permanent food establishments, food trucks, farmers market registration. The bulk of the fees come in from permanent food establishments, which are basically restaurants and grocery stores and convenience stores. Again, you've seen some of these tables before as well. Our current fee schedule is based on the number of employees that a facility has. So for restaurants, it's number of employees. For grocery stores, it's square feet of the facility. And that's pretty typical around Indiana. But an alternate way might be on gross revenue. So some health departments base their fees on gross revenue. But what we are proposing and that we discussed last time, your support for, was switching to a risk-based model, which is starting to pop up a lot more around the country. For example, the whole state of Ohio has risk-based pricing for their restaurants, and it's consistent with the FDA food code, and it's also consistent with how we have to inspect those facilities according to that FDA food code, which the state just generally adopted. So this basically means a level 1 facility is something that doesn't require a ton of oversight because it doesn't carry a lot of risk to the public. So an example of that would be a coffee shop, right? Where you're not making a lot of food on site. You're not, you don't have a lot of things to monitor. Maybe you're only serving prepackaged muffins or something like that. That would be a level 1 facility. A level 4 facility, on the other hand, would be serving very vulnerable groups such as nursing home residents or hospitals, things like that. And we don't really have any level 4 facilities and Fishers under that designation. There is some, the way that the FDA categorizes these risk levels, so they have a table and a chart that categorizes what facilities fall into that. But within that table and chart is kind of a natural incentive. So one of the criteria of that table is that if you have a strong history of performance, and demonstrate good practice. Yes.
So the nursing home facilities that provide meals are not.
So they are covered sort of, but those are regulated by the state.
Yeah,
So we have no.
So we
jurisdiction.
don't,
Okay.
yeah,
we don't regulate them.
Okay.
Yeah.
you get surveyed by the
Right.
state. That's a
The
much.
hospitals get surveyed
Yeah.
by the state instead of the nursing.
Private schools,
A preschool if they had vulnerable
Private.
kids, but a regular school not.
yeah, state.
Yeah.
Okay, gotcha.
So the high schools and the.
The high schools, we certify the high schools.
Oh, we
Yeah.
do.
Yeah, but those aren't vulnerable populations.
Okay.
Right. So they don't fall in
So they would fall into the
level 3.
level 3.
Yeah.
Okay.
Yeah. The other thing that's kind of handy about the risk level is it corresponds with the number of inspections that they would expect to get in a year. So roughly you're doing 1 inspection a year for a level 1 facility, you're doing 4 for a level 4 facility. That's the benchmark or the goal. It doesn't always happen, but that's the benchmark. So we are proposing that we go to a risk-based model because that correlates with how much work we put in and how much oversight we have to have and how much risk it carries to the public. So I have some other example fees of different types of things that people are charging, and they're wildly variable from anywhere from $75 for a permit fee to $1,200 for a permit fee. There are, again, a number of jurisdictions around the country that use this risk-based system. It's not even mine, it's somebody else. I think I declined it. No, she really wants to talk to you.
It should go.
Thank you. So we are fortunate here in Fishers in that we have already implemented a grading scale for our restaurants. So we have a really great, easy way to measure a history of strong performance, to move someone up or down a risk level in this process, right? So it provides that natural incentive, which I know was part of a concern when we started that grading scale. As we all know, the grading scale has been super popular. I think even the operators generally like it, especially because most of them at this point are in the A range, right? So, and that was what was supposed to happen by incentivizing great performance. So this would further incentivize that good performance because facilities that are in an A range would get bumped down a risk level. So the vast majority of our facilities right now would be in a level 2, not a level 3. Even though their restaurant type would be level 3, they would be in a level 2 for the permitting purposes. So you can see the number of facilities that we roughly have in those categories right now is on that. So where it says level 1, 119, that is 119 facilities that currently fall in that, whether they're baseline level 1 or whether they're baseline level 2 that has a strong history of performance got bumped down to level 1, if that makes any sense. This is all very complicated, which is why it needs a lot of time to talk. Yeah.
So do you need a motion on recommendation 1 to move to the FDA?
Yes.
Okay. Can I?
And then I'll need a second one regarding the specific fees or the benchmarking of the fees.
I have a question for special rate. Sorry. I agree. I think this looks great. I was thinking on the expense side. So I was looking at it says 3 FTEs plus 10% overhead. So in theory, if everyone is moving up from level 3, level 2, and we do it citywide, and we have wonderful food service here.
Right.
Then we have less work to do. Does that mean we would go to 2.5 or 2 FTEs? Because if that's the only expense, how are we actually saving money?
That's a great question,
They're going to
but
give us less money because they're doing so well.
We
Our
would-
expenses don't change, then we're just.
we would really love for that to happen.
Oh, exactly. I understand.
And if we got to that point, I can tell you our 0.5 FTE would be happy to finally retire.
They're not gonna give us less though. Right?
So if they move from a 3 to a 2, they would give us less money.
Well, right, they will, but because I was gonna say, the revenue almost doubles, right?
Yeah.
Like
Yeah.
today,
So,
if it stayed.
so it's not an exact science, right? Like,
Yeah.
but,
Well, it doesn't.
but the purpose, right, the purpose is to just maintain strong food protection standards, right? And if we can do that without as many inspectors, then that's an option that we have for the future. But the purpose isn't to, maintain everything we have, it's to maintain the standards.
So just like, because, 23 times $300, if they all move up to level 2, that's not an insignificant amount of money.
Right. And before you guys make your recommendation, I have a second slide just to go through examples, example scenarios, if that's helpful, right? So example 1, restaurant A is an established facility with 31 employees. Their baseline FDA food type risk level would be 2. So it's probably something like a Subway or a BB Bop or something like that. They have received an A grade each time they've been inspected. So they have that strong history of performance. Their current permit fee would be $400 because they have 31 employees. They have no incentive built into that for a level A, except for that people like to see it on their window, right? So this proposed permit fee structure, the permit would be $300 with the rationale of it's a baseline level 2, which would be $600 if at that proposed fee schedule, which we haven't really talked about, right? Minus the $300 incentive of getting bumped down a level for being a strong history of an A, if that makes sense. So their fee would could potentially go down if they were in that category.
The employee number, is that, greater than 31 or greater, or is it,
It's, so our current fee structure is 21 plus.
okay,
So that's what you're just comparing. what
I was
they
comparing the
currently-
current fee structure is based on
Yeah.
employees.
Yep.
The proposed one,
Material. in the
Okay.
Right.
It's just, it's just to let us know where they're getting.
Yeah.
it's just like, okay, under the old structure, it would
Okay.
be
Gotcha.
this,
Right.
under the new structure, it would be
Okay.
this other
Yeah.
thing, right? So example 2 would be restaurant B. It's a new facility and it only has 9 employees, so a small facility, right? Their baseline risk level again is 2. But they received a C grade each time they've been inspected. Plus they're a new facility, so maybe those things are mutually exclusive, I don't know. At any rate, they result in the same thing from this proposal, which is that they need to be bumped up from their baseline from a 2 to a 3 for the purposes of the FDA risk levels. So their current permit fee would be $200, but they don't have any kind of monetary penalty for a grade C other than that it does impact their bottom line. If people aren't coming. So under the proposed permit fee, it would be $900, which would be $600 for the risk level 2, and then essentially a $300 penalty, even though that's not how it would be structured in the fee schedule. But because they are new or because they don't have that history, they get bumped up on.
Like, I have a quick question.
Yeah.
Thank you. This is very clarifying in a complicated.
It's very complicated, yes.
And to that point, I guess, have we done any studying of like, if the same thing happens in 2026, it happened in 2025? So no new restaurants, nobody changes number of employees, no one changes their grades, they all kind of stayed exactly the same. What do we know what that would mean? Because I think in some cases, they would save money and we would get less money, but then in others, obviously the opposite. Do we have a?
So that's what this,
Okay.
this table is. So
Everything
yes.
stays the same.
That's based on our current, like where our restaurants are currently on their grade levels, right?
Okay.
So you more than double the revenue.
Yes,
You just don't make it to the 250 because you only,
right,
yeah.
Okay. got it.
yeah.
Thank you.
Yeah.
Well, and plus this is just for restaurants and we have
Yeah.
a small chunk of things that are in other categories that we'll discuss here in a minute.
Yes, I said, yeah. I skipped.
it's a significant increase though, I mean, it's.
It is.
Yeah.
So I know I only have the one recommendation outlined, but it really should be 2. One is like on principle, do we switch to the risk-based model? Do you support that? And then 2, what about these fees? Because it is a pretty significant increase for our operators, right? But again, the direction I heard from the last board meeting was let's get closer to sustainability. So this gets us quite a lot closer to sustainability. How far we want to go. Again, ultimately it's up to city council, but ideally on your recommendation as well.
So you get feedback on the grade, like the ABC, that the providers are enjoying that because they get, it's much more transparent. To me, this sounds like it is, yes, that it goes up, but it gives them some stake in the game too. The incentive
Yeah.
here is that we'll drop it by in some cases half, all the way down to 300. I think at least gives them a say in the outcome as well. It's not that we're just raising the fees, it's that
Right.
you have an opportunity to have a vote in this as well. And, if you are maintaining an A, then it's not gonna be that.
And
Because
that
right
was
now,
the-
it's not, the grading is not tied to anything.
Anything, it just, there was outside of performance.
Yeah, outside,
Financially,
but no financial, there's no financial benefit, except that maybe people don't
Marketing,
come to your, yeah. Yeah, but there's nothing,
With the
me
city.
getting an A doesn't make it, to your point in the first example, there's no incentive. So I bet so I totally agree with the changing it to risk-based. I think where people are gonna balk are the fees, which
Right.
unfortunately, if you don't charge those fees, you're not gonna get closer to the. I mean,
It's not ballpark, Monica, right? I mean, with these other, the comparisons that you used.
So we're in the ballpark, not with some comparisons, right? So they're wildly
Yeah.
variable. The ones that are at 75, like everything's super low. The ones
Right.
that are at 1200, everything's a bit
But
higher.
you're comparing.
But yes, we're in a
urban and Rural.
We're in a ballpark.
Yeah,
Yeah.
it's a fruit
Yeah.
salad.
Mhm.
75 to 1120. That's,
Yeah, to other,
that's a range.
that is a range.
And that's not for one single health department, right? Like that's
Is that
That's just-
many health departments, but just in Columbus, Ohio, for example, they have a risk-based fee structure. And their range is 143 to 1253. Now I'm only proposing it for the food operators, not for the grocery stores and convenience stores, right? But for the food operators, which is basically restaurants, right? So Columbus, Ohio does theirs theirs is wildly more complicated. Because they are doing the risk level, but they divide it into commercial versus non-commercial, which is like grocery stores versus the other ones. And then they have square feet versus like less than 25,000 and greater than 25,000. So for every risk level 1, you have, is it commercial or non-commercial? And is it less than 25,000 feet or greater than 25,000 feet? So they have a very long fee schedule just for those two basic categories. And so in their fee schedule, a non-commercial risk level 1 would be $143 and a commercial risk level 4 at greater than 25,000 feet would be $1,253.
Oh, okay. I think we talked about this last time, but remind us, what's Marion County doing?
What
Do you
are they
know? Or
doing?
do you know, like, do you
So-
know how they,
So no.
how our fees compare? That's what.
So I don't
Yeah.
know it off the top of my head. Allen County I know is pretty expensive. I remember
far away.
Allen County,
Yeah.
yeah, was pretty expensive. I don't know if Laura has it handy because she looked at all of those
Sorry.
recently. Nobody in Indiana has done the risk-based fees yet.
Yeah, okay.
Yet, right, but it is becoming more common across the country, and I think is that really the thing that makes the most sense with the FDA standards, the fee changes, and the incentive structure that we already
Right.
have, but
Right. What
but we
there's-
don't have to switch either, so.
No, my thought about it was, I can imagine if if I'm sitting on the city council, I want to know what the fees we're charging.
Mhm.
I don't, debating the employee versus risk level, I think is less of an issue. It's going to be more of an issue, I imagine, from saying, how much are you going to charge me as a business owner? So is what we're proposing charging comparable to Hamilton County and to Marion County, even if it's not risk-based?
We've heard, so the $75 to $11.25, that's a spread from Indiana Health
Yeah.
Departments. But I don't remember which ones
Right.
it was. I think Laura's trying to find it and we can get to that,
You
but
can make a really easy case if Hamilton County charges prices that are close to what you have
mhm.
proposed. I
They're
don't,
not close yet, but
not-
we have heard that they are most likely
Moving.
going to be raising, and a lot of the health departments are looking at raising rates, but we
Yeah,
don't know what
but you
people
don't
are
know.
raising at yet. And again, just
Public health standpoint, yeah, I like the incentive, I think, because it gets, you know, if we get it, hey, that's accomplishing our goal. I
Right.
think elected officials, that's their job to find out if an extra $200 a year means I'm gonna open a restaurant in Noblesville instead of Fishers.
right,
They can take care of
And,
it.
and again, just a word about the timing. I mean, we could always wait until next year to talk about changing the fees and wait and see what everyone else does. The reason for trying to have this
Yeah,
meeting
you-
early and to get into city council, because we have city council on Monday, is because our permit fees for the next year, our permits open on December 1. So we're just
Yeah.
trying to meet that deadline. If we want to make these changes, we want to get it done so that we can do it with the new food permits. Yes.
When you looked at comparables, did you compare environments like urban, suburban, and rural?
I didn't do an extensive like
Mhm.
analysis in that I can give you. We've looked at lots
What
and
did
lots
you
of
gut
fees.
pick?
We've looked at lots and lots of fees, right? Like I think the 1125 that's somewhere in Indiana, I think that's a rural area, and we were really surprised that they had gone that far. with their fee schedule, but I think they were, really so hit by Health First Indiana, they felt like they had no choice to sustain their program, right?
Yeah.
So
Um,
they get no money anyway.
Allen counties, I think, are quite a bit more. I don't have
That's
any
what-
sense. Yeah, I don't have any sense of what Hamilton County's thinking, but it does seem to be fairly wildly variable, honestly, as far as sense goes. Obviously, like San Diego and Maricopa County and LA and all of those
Yeah.
have higher fees, which was one of the reasons I used Columbus as kind of a comparator, because they had this risk-based model and they're not so wildly different from us, but.
I'm just trying to think what's gonna help you get it through city council, because the thing I don't wanna do is that you tie them, like, let's say this happens. You bring them both
Mhm.
and they sabotage the risk base because they don't like the fees and they don't see that. They're not able to connect the dots because they probably aren't gonna have a whole lot of time. I don't know how city council works. I've not been doing, embarrassingly enough, I have not. Well, that's what I figured. It's fast and if it works like any other board works.
They
You're-
go out, they go out their own base, but generally 2 meetings to review and.
Yeah.
Exchange and try to figure it out. And if they decide to give feedback or.
Yeah.
It could extend longer. generally.
Will the fee sabotage
I-
or is it hard to say?
No, I think it's hard to say.
Okay.
I understand your point.
Yeah.
If the risk-based transition is where we want to go, you don't want to throw the baby out.
Right, that's right. Yeah, that's right.
So-
Like, do you?
The fee, I think, is just something that we're gonna have to socialize and talk to them
Yeah.
about and get their feedback.
Yeah.
Educate them as you.
Okay.
And it's helpful, just like we are intending to go for 2 readings if possible to
Yeah.
put on Monday and then the next week. And then we are intending to have a webinar with operators to talk this through with them in the
Yeah.
middle so that we can incorporate that feedback if we need to change anything. And again, I'm not like, these are the fees that get us close to sustainability, but we don't have to start there. So again, looking for the board's recommendation.
Do you anticipate any remonstration or? city
No.
council?
There's even a world where someone's fees could go down. I mean, 10 to 20 employees restaurant,
Yeah.
2,300 now. Then I mean, it could go, well, at least stay the same, I should say. Or 21,400 can go down to 300.
300,
Mhm.
yeah, it could, yeah.
It's an outside case,
Did you
but
find
it
some?
exists.
Right?
It's performance-based, yeah.
And that's fair.
Yeah.
So.
And risk-based, right?
Yeah, which is fair.
Marion counties is anywhere from 75 to 225. And then Allen County is minimum 300 to 500.
Marion County has escalating reinspection fees too, that jump really fast and really.
Which we'll talk about here in a minute.
I mean, Marion County's kind of unfair because it's be smaller. But like,
And Hancock County,
oh, yeah.
which is minimum 150 all the way up to 600.
Monica, what do you need?
So if it might be helpful, I can go through the other changes as well, so you can kind of see them all at once and consider them like more fully, if that's full. Before you make a recommendation on how we should move forward.
Is this price level for that's 1849?
Where are you at?
That's what it need to be. So this is what the yellow is posted.
So 1,200.
Yeah, so 1449 is to be sustainable. Like that's how much we'd have to charge.
So we'd actually have to charge more than the highlighted too, yeah. So-
Well, and again, that makes assumptions though that we don't do some of the other things.
Well,
Thing.
that's only, yeah, you're right. You've got, so these are also
Yes.
fees that get you
Yes.
to 250.
Yes.
Okay, okay.
So, just so you guys can see this all like fully, so the food permit, so these are the other type of food permits that we have. So I mentioned before the retail food permits, which are 4 levels by square foot. And I would just suggest keeping those by square foot. It's roughly equivalent.
Grocery stores.
These are grocery stores and convenience stores. So like the smaller ones would be gas stations. The really large ones would be grocery stores. And those do take a long time to inspect because they have like the meat section and the seafood section, like, all of those different areas. So again, here's the range of those and some potential proposed fees for that. Plan reviews right now, we have new facility and remodels kind of lumped together. I would propose separating those because the new ones take a fair amount longer to review. And then we have a separate one for plan reviews for just a change of ownership if they're not remodeling anything. So let's see. And then we have a $25 processing fee on those. I would propose just eliminating that as an extra barrier and then just rolling it into the increases generally. We still have that grade change request fee, and that was from our grading scale. So if they were graded and they got a C and they wanted to submit for a new inspection to potentially raise their grade, they could do that. We had 2 of those this past year, so it's not a ton. But I would propose raising that to the equivalent of the risk level 1 fee because it's equivalent to 1 full inspection, which takes several hours. So again, the fees are not just sustainable, but they're also based on like how many hours does it take us to complete that task? And what does that, divide out with our inspectors? The farmer's market fee is currently $5, which has absolutely nothing to do with the amount of work that it takes us to maintain standards on those farmer's market vendors, which really are just essentially so I would separate them into 2 categories. One would be the food trucks and the other would be the people that put a tent up and then they're cooking food there. So that probably should be looked at in some way. They're typically inspected 3 times over the season. Let's see. And then temporary food permits, you can see are prorated typically as either a one-time for the year at less than 3 days, or they're, prorated on when they apply. So if they apply in October, they get a 3-month permit. If they apply in June, they get a longer permit.
Monica, is the processing fee already built into the proposed fee in your chart?
Essentially just because I'm proposing raising the fees generally.
Okay.
So you're taking, yeah.
So we don't add on.
I didn't add it on. No, it just seemed like
Oh,
maybe we could give something, like we have this processing fee for new
Yeah.
permits and it
So,
just,
but you just take that out
and it
because
just
you're gonna,
felt like, could we
yeah, like
roll it
why?
out? Because it just feels like an extra thing.
Think.
Yeah. But, I'm open to any thoughts or considerations on that. And, let's see. And then just a note about food trucks. They are going to be permitted by the state in 2027, according to the new legislature. We are still not clear on how that's going to work because I think we're still supposed to inspect them, but they're going to be having one centralized permitting process. So we won't have any control specifically over food trucks when it comes to the permit prices. So there's not a lot of value in taking them out of our fee schedule as a separate entity, even though they require a separate process, which is why I kind of am proposing that we have a baseline annual initial inspection fee for food prepared on site. So that would cover food trucks and like somebody that brings their barbecue grill for an event, because we have to inspect the equipment that they use if they're preparing food on site. And that's a bigger inspection, and we have to do it before they set up and then while they're operating. So, so that's the rationale for that. And I'll go on one more, just so you get the whole picture. And these would be essentially fines. So this isn't a huge change from what we have, but there are some necessary changes in language because the state code has changed. So our current, we call them miscellaneous fees in the fee schedule. They are more like fines to me. So if currently in our fee schedule, if we do more than 3 inspections or consultations, like we have to keep coming back, we can charge $100 for each $100 for each reinspection after 3. So I would propose that we charge $100 each time we have to come back. If we have to reinspect at all, we just charge $100 each time. And then our current fee schedule has 2nd, 3rd, and 4th critical violations. We can charge $50, $100, and $200. The code language has changed from critical violations to what they call priority violations and priority foundation violations being a second tier, and those come with requirements for us to reinspect. So we would recommend a penalty for each one of those that we have to come back if it isn't corrected on reinspection. So they'll know about it on inspection. They can correct it before we come back, right?
Mhm.
But if it's still not corrected
And you have to come back.
and we have to
again.
come back, yes.
Oh, goodness. Okay. Oh, so you charge $50 the first time. Yeah. Okay. I see. what-
Yeah, so it's not dramatically different on the fines that we already have, but it's a different way of implementing or structuring that
Oh,
I'm
I see.
proposing, if that makes any sense. So I know this is a lot and this is taking a lot of time, but appreciate any questions, concerns, thoughts, and I guess when we're thinking about the fees, and what you want to recommend, maybe for me to propose to council, if we think that we might be hurting ourselves too much with too much of a leap, perhaps a recommendation of 50% of that to start, or 75% of that to start, or something like that would be a useful place that we could start as we go through this with council.
Chris, of the three recommendations, am I correct? They all have to be done separately?
I think you can make them, if there's agreement, for everybody on all three.
We do most of that.
I I love this risk-based thing. But at the same time, I like where you have something like Marion County has what, a $75 to 600, what was the number that we said?
Yeah.
It's maybe like 75 to 250 or something, you said, Laura?
Yeah,
And then
225.
To
But then like you had said, they also have.
They have escalating reinspection fee, which is a lot different. I think it jumps like $500 by additional violation or something like that. So it's, if you have to go back a third time, you paid $600 for those 3 re-inspections.
So the wheels are spinning here. It's just sort of like saying, why not have some other fee that's, you can do the risk-based, whatever. You can maybe lower those and then say, hey, but these re-inspections, that's where we're, that was on you. You went from an A to a whatever. And that required
That's what
re-inspection.
you've already got.
And that's the recommendation 3, right? Like this one.
With the, why not bump those prices up and lower the risk-based ones?
We can do that.
I mean, I'm just, because that to me is like, that's saying, hey, you failed and that's on you.
You're not gonna get close to revenue though. You're not gonna get close, because
Skyrocket.
unless you have a ton of, like, how many, I guess, well, let me say it this way. How many restaurants do you have that have to be re-inspected?
Like a lot of them. A lot of them.
But more
Under
than
the new code, under
more
the new
than 3
code,
times.
under,
That would
not very
actually get
many,
to-
maybe
They would actually get $100.
10% maybe.
Yeah, so that's the problem. You want
Currently,
the math-
under the current. if
The
it's more than
math,
3.
yeah.
Doesn't.
I'm-
include enough revenue.
Yeah, I was gonna say, I'm afraid you're not gonna have enough restaurants that need to be re-inspected at that rate to get you to
Yeah.
the.
And the principle I was trying to go with was like, how much time does it take us to do those?
Yeah.
Because the full initial reinspection that we're required to do either 1, 2, 3, or 4 times a year, depending on the risk level,
Yeah.
right? Takes us 3 to 4 hours, right? So the re-inspections are quick because those are,
Cause you're going after a couple.
because you're just spot checking
Yeah.
the things that were in
Right,
violation
not the full.
before, right?
Right.
Right. So I was at least the theory I was going with was based on the amount of staff time that it takes to conduct those activities and what that staff time is valued at. So maybe recommendation to go to risk level first, separate from the proposed fees.
Yeah.
On who recommend proposing a fee schedule based on risk levels defined by the FDA, which is recommendation 1.
With the fee schedules or with the fees as,
I was gonna.
Let's separate
I
it.
was gonna follow.
okay,
that
let's do
Yeah.
that, okay.
Recommendation.
So I second
Yeah.
that.
Guess we put this to a vote. All in favor?
Aye.
All right, so we passed the risk-based fee change proposal
Right,
based on these numbers.
yes.
Now we have to.
And now, like, what do you think about these numbers? Are they
The fees.
over? No, not these are the permit fees. Yeah,
Yeah.
yeah.
What do we
the
think
permit
about
fees.
the?
What do you think about the fees? Yeah, sorry. Are we gonna overshoot it? Should we dial it back significantly?
If you don't expect any remonstration, I would rip the Band-Aid off. Haven't been through stuff like this with ambulance billing.
But you're billing the patient, not the business.
Insurance, we're billing insurance.
You're billing the, well, yeah, okay. Yeah, sure.
Is this the number of restaurants, 2 at the level 4? Is that number?
Yeah,
Yeah,
so,
that's
and those are new facilities. So those, we only have 2 at level 4 because those are new facilities that would normally be in a level 3, but because they're new, they require increased attention according to the FDA criteria.
So then the following year, like they would.
If
go-
they have
Go to
A's,
a-
if they have A's, they would go to a level 2. If they have B's, they would go up to a level 3.
You have a, so you said you want 2 readings
With council,
with
yeah.
council. So do you have a, so to your point, do you rip the Band-Aid off and propose this? And then the second time, can you come back? Yeah,
Yeah,
you can come back with a,
with an adjustment, yeah.
you can adjust it and then you've not potentially, since we've not tied them together,
That's right.
you've not thrown it.
I think
Not
that- I
ruined
think
it.
That's the way to propose it. Like,
Yeah.
we made the recommendation to switch to risk-based, the initial fees that we're proposing.
Kind of a
Initial
negotiation.
feedback, right?
Yeah.
On fee structure.
Yeah.
Yeah, Monica will be politicking before the council meeting. Educated. Educated.
Katie,
Educated.
Yes, because this is very complicated, right? Like, it's not easy to wrap your
Yeah.
head around, how to do this.
well, and I think it's helpful to say things like, look, those 2 in the level 4 are new restaurants. It takes a lot of time. This is why,
Right,
and they could easily, if they go to an A, like you said, they go back to level 2. so
Yeah.
that there's incentive. It's not that
Right.
they're
Yeah.
2 existing
They're not stuck
restaurants that
there. Yeah.
every year are gonna get a fee assessed at $1,200.
right.
So-
And typically people expect to have things be more expensive when they're starting something
they're
because it's
starting.
the cost
Yeah.
of doing business. You have to have the plan review fee, you have to do
Right,
these different things. You're
right.
gonna need to have a little closer watch, but
So any new establishment gets a level 4 coffee shop?
it gets 1 level up from where its baseline is. So if it's a
So
coffee shop, it's a
would get
level 2.
Yeah.
Okay.
Yeah.
And then
Yeah.
if it's sustained, they get A's, that the following year they go down to.
Yeah, the only thing that can't go down is level 1.
Well,
It
right.
can't
you're
go
level-
down any further,
level 1.
right?
Yeah, right. Okay, so I'll make a motion to use these fees as you have outlined for the risk space.
To suggest to council.
Yes.
Okay.
Second, that.
So the motion is to
Keep what you.
keep those
keep those.
fees
Mhm,
and suggest that to the city council and see what they
mhm.
come back with.
Mhm.
So recommendation 2 or lower.
Yes.
So all in favor of that?
Aye.
I guess that knows, no? I mean, that passes.
Yeah, because you'll be really mad if you cut those fees and you walk in and they're like, yeah, we'll take it. And you're.
You know,
You'll be like,
ask for what you need.
that's right, after what you need. And then they say, I wasn't sure you could do that, so I wanted to make sure we could do that.
Which re-inspections are the more time consuming then?
The higher the risk level, or well, actually, it's the lower the grade. It's the more violations they have is really the more involved. So we have a few facilities that just, we have to go back to
Yeah.
quite a lot. And, you know, to have things continually uncorrected and uncorrected
So-
is very time consuming, which is, part of the reason for proposing, like I think the
That's on us.
the
That's,
third recommendation, yeah,
Yeah.
even though it's not dramatically different on the amounts, I think the way that it would be applied would feel different, right?
Yeah, so I was trying to figure out, on the coffee shop,
As a penalty, right? Like,
and, you know, I had 1 violation, and I had now a level 3 that had 20 violations, that he says that It's the same thing.
So, no, so example, a coffee shop, you have one violation if it's a priority violation,
Mhm.
right? If it's, so some things can be corrected on site, actually, right? And we don't have to come back. So if you can correct that thing on
So you
site,
can correct it while we're doing.
if you can
the
correct it
inspection.
on
Yeah.
the original inspection, it still may ding your grade, but it's not gonna, we don't need a reinspection fee. We don't need to ding you when we come back. So another example is, let's say you have a violation, you couldn't correct it on site, but so we have to come back, right? Then you would have $100 reinspection fee according to this proposal. And then depending on the type of violation, if we had to come back that first time, right? You're $100 for a reinspection. If we come back and we reinspect and you've corrected it, then there's no additional there, right? But if we come back on that reinspection and you haven't corrected that thing again, then we ding you the first time $50 for each priority violation. And usually these ones that we have trouble with have many priority violations, right? So it's for each priority violation and for each priority foundation violation. And those are the things that deduct points from their score. So it's directly tied to their grade, right? But if we're continually having to come back and correct the same things that you haven't corrected from the time before, then it's going to escalate on the fines. And that's kind of what you're suggesting. I think that
Well,
like the guy that didn't correct it should be
yes and no,
penalized. No? Okay.
because if I have two restaurants, two identical restaurants, one has one violation, one has 20 violations. And they both get them all corrected, they're only paying $100 each, but it's more time consuming to go through 20
Talk about it,
violations.
set it as one.
Correct. Yeah, but you also have it doesn't change your grade level. So if you have one violation, you're still going to be an A most likely, versus if you have 20, you're most likely going to be a C or closed. So it's still going to affect your bottom line on that. But yeah,
What's your,
we don't recapture that. It's their business bottom line. But I mean, our primary goal isn't to recapture the revenue. Our primary goal is to make sure the food is safe.
Yeah. I'm seeing it also on the.
You're talking about the time.
But
Yeah.
from a
From our time.
from an
From-
inspection,
Yeah.
an inspection period, like, so the first inspection, they're roughly equivalent on the time that it takes because we have to go through every single point, whether they have a violation or not, right? It's only on the reinspection.
Yeah.
So you're talking about on the reinspection,
the
you have to go check all 20
Yeah.
and they may have to go check only
One.
one,
So
right?
why isn't the reinspection fee for somebody who has
20 violations.
20 violations?
We could.
more?
We could
Yeah.
do that. I mean, we
Yeah.
could say like
Like,
less
is there
than,
a threshold?
less than 5.
Less than
Or-
5, it's 100, more than 5, it's 150. I don't know. I don't know.
I mean,
what-
I
No,
just,
'cause-
once again, it's just a way to incentivize.
Yeah.
We're talking about,
Especially if you're making the case that the reason why you're charging for reinspection is time it
Right.
takes.
Right.
And that's
That's
a
what I'm saying.
really,
That makes
that's a really valid point because no matter what, I'm spending way more time if I have more violations.
It is, but it's not a dramatically different amount of time. Most of the time is in getting there, getting back, like going through the checklist. But yeah, I mean, I hear what you're saying, but
Yeah.
it's still
we're just trying to-
roughly,
Okay.
it's roughly an hour to an hour and a half.
I want to know why I'm paying,
Yeah, yeah,
$100
yeah.
for my one little
Yeah.
violation. And the person next door is paying $100 for their whatever.
right, right, right.
And
And you say, well, because of manpower, like.
Right, I think it's hard, yeah, yeah.
You came in here. for
I'm
the-
happy to take your
figure was off or
recommendation.
whatever.
Right, I mean, yeah, I don't know if people get that. It does, it incentivizes behavior, right? To
Right.
not have a lot of even
Yeah.
if you have a violation, you don't want a
Right.
lot of violations, because
It adds up.
it adds up, yeah.
Yeah, that's what I'm.
Yeah, that's what you-
That's what I'm just suggesting.
Okay. Well, do you guys want to vote on recommendation 2 or vote of recommendation 3 or?
Well, now it's.
Where do you wanna go?
Well, this one's recommendation,
I
like. the
know.
fines are
We
recommendation
skipped over
4.
2.
We skipped
Well,
over
yeah, I
2.
know.
Yeah,
This
yeah.
2 is the 3 now, but that's.
Saul went straight to the fines. He went.
You went straight to the fine. So let's skip back to the recommendation 2, the other food permit types.
Oh, wait,
Any
this one.
feedback on that?
Yeah, this
Yeah.
is taking as a retail food market and.
Yes, yes, yes.
All right, so I don't, open to discussion on this one, because I don't have anything.
There's a lot on this page. I was like, okay. No,
You know, yeah.
oh, you need a motion to,
No, I mean, no, I don't have anything here. So everything's fine. So this is, yeah, motion to
approve.
approve this. The foods permit fee change
So no
proposal,
process.
which would be,
This table, this whole table.
Those food tables.
We're, this, I move to approve this full table.
Okay,
I second No,
Yes.
we should have names.
Food permits fee change proposal.
Sorry,
They're all food permit fee.
it's
change.
recommendation 2 as listed in the
Which is really now
Packet.
recommendation 3,
That's-
but yeah, yes.
apologies.
Okay.
Increase,
Yep.
increase other food permit fee types. Okay.
And the votes for this change. Aye.
Aye.
No. So this one passes for these food establishment types.
Increase other food permit fee types. There we go. Okay, now we're back to fines.
Now we're back to fines.
Monica, you poor thing. Weird.
Well, I mean, it's complicated. I know it's complicated because
We were wondering, oh, okay, we were discussing on the ones that have re-inspections.
I think we might have made
Okay.
it harder.
I think we made something.
Talking about the manpower required for someone who has 20 violations versus 1 violation, and it's only $100 of.
Reinspection, yeah.
And we were wondering if maybe a per violation, because if you have more violations, that requires a little bit more manpower,
Mhm,
and you should be paying more
mhm.
than someone only has 1 violation, 2 violations. And that was a suggestion.
Can you up it by like $50 every 5 violations?
Yeah, that's
I
just,
think there's gotta be a play when the,
Yeah.
like the plumber comes out, it's, it's $80 just to show up, because that's what it costs just to get there,
Yeah.
right? So
Yeah.
that can't change. There's gotta be a floor. It's not gonna be
it's $100,
yeah.
It's $100.
Go up.
50 per 5.
How many?
50 per 5 violations
what do you
requiring
get?
reinspection.
What is the?
Yeah, what's the, that's
number you see when you have?
Yeah, what is the landscape? What's the
It's all over the place, right? Like, I mean,
Do you see as many as 20?
yes, and that would typically result in closure until they're corrected and they're safe to open. I mean, it would be rare, right?
Is 5 a decent break point? Like, is it, if you said,
I think 5 is a decent break point
5
if you're
less than-
lumping, because we have to go back for priority violation and priority foundation violation. We're required to go back within 70, or they're required to be corrected within 72 hours if they're priority violations, and they're required to be corrected within 2 weeks if they're priority foundation violations. I don't know who came up with these names, but that's what they are in the code. So the priority violations are the serious ones. Those deduct 5 points from their grade, each one of those. And the priority foundation deduct 3 points from their grade for each one of those. So it's all based on how much impact they have on safety of the food, right? And risk for infection as a result of that. I don't have any analyzed breakdown of how many of each of those each facility has, but if you look at the scores on the restaurant grades, and we have a couple of outstanding facilities that have 100, but the majority of A's, I mean, you can get down to an 81 for an A, and an 81 is means that you have a combination of priority violation, priority foundation violations, and then there's the third category, which I think is core violations. Those are 2-point deductions. So basically everybody starts with 100, and then they are deducted 5 for every priority, 5 points for every priority violation, and 3 points for every priority foundation, and 2 points for every core. So you can see that even the people in A still have a few, right? They could have either 3.
And
They
they still
still
need to be
priority.
re-inspected.
They still have to be re-inspected according to the state, the new state code.
At least 3 still keeps them at an A.
Yeah,
5, yeah.
5 sounds pretty good.
Seems pretty rational.
So for every 5 violations requiring re-inspection, which would be priority or priority foundations,
Mhm.
for every 5, we would add $50.
So the baseline, yeah, so you start out, you have less than 5, it's 100.
Uh-huh.
Yeah, less than,
Yeah,
not,
less
and then
than
5 to
5 to
9,
9.
it's 150.
Okay.
Is that something that city council can tweak those numbers? Like we did with the first proposal?
Yeah.
So we pass a motion to adjust the
Mhm.
fee change proposal based on violations with cutoff being for every 5,
Mhm.
and then pass another motion suggesting for $50 and then
Mhm.
whatever the city council.
Mhm.
come back with. And getting back to the other places, Columbus,
Uh-huh.
Ohio,
Mhm.
we don't know the underlying, what their other stuff is. We just know what their base.
I have it somewhere on my desk. Yeah, I mean, their fees, they have a much more detailed, more in-depth fee schedule. So we're kind of trying to balance something we can manage
Yeah.
and it's, I mean, you see how complicated this is and like.
No, that's what I'm saying. I'm
Something that we can communicate
Right.
and
Like, why reinvent
and help
the
people
wheel?
understand.
What someone
Well,
else.
somebody else has done, yeah.
And Allen.
Yeah.
They seem like they had a low fee, but they must have a higher on the reinspection and all that. other
And like
stuff.
Marion County has higher penalties for reinspection and that kind of thing. Yeah. So,
All right.
So one question, you mentioned, I mean, heaven forbid everyone ever gets shut down or closed. Is that they get to reopen, is that just baked into these fees, or is it a reopening fee, or they come back in as a brand new restaurant at level 4, or how does that work?
we don't have a reopening fee. Would
It's
you
just-
like to recommend something?
I didn't know if that was, 'cause I didn't.
That's a possibility.
Again, ideally, things like this, keep people on the right track and never. That's plan A through R.
Right.
Yes, exactly, right?
Yeah.
Please,
Don't get to
just
that,
don't get there, right?
don't get there.
Monica, what do you think, a reasonable reopening fee would be? Is
I
there?
don't
any-
know, maybe $100 or $200. I mean, I mean, I don't know, like we have to, so in order to get somebody
Chris,
reopened.
what do you think a reasonable?
Like, I don't want to comment, I don't
I
want
have no
to.
idea. So in order to get somebody to reopen, we have to go back out and inspect, and oftentimes that's every day. So we're probably gonna be
You're
out there
charging it.
every day
Oh, you're already charging.
to inspect them until they're at a point where they can reopen. And their business is getting substantially hurt because they're not able to do any business and they're not bringing in the charge.
Yeah, they're
Yeah.
getting charged.
They're getting charged every day you go
They
out.
would be going, if they're usually motivated to get open as soon as possible. So they're asking us to come back every day. So we would be charging $100 each day that we have to go back
Or-
until they're at a level where they meet that. Then, when they're reopened, they cannot reopen any higher than a C. If they got less than a 60 on their score, like they're
But
getting a C.
but every time you go out in this proposed, you would
Yes.
be, if they had. 'cause
Yeah,
they
and they would
likely
be
have a lot of
getting-
Violations,
And they
right?
would
So
be,
it
and if they're not open
Yeah.
the
That sounds
next
like a
day,
good
they're gonna
idea
be,
That is-
Yeah, the violations.
That's enough.
Never mind.
That's already big.
Yeah.
We don't need to. They're killing the business themselves. We don't need to.
Yeah, really.
yes.
Okay.
Little diversion here. So even though the state is gonna take over permanent food trucks, we still have jurisdiction, right? Because they're cooking food.
That whole thing is not super clear. So they have a committee working on how to actually implement that on what was passed. And actually our food inspector is on that committee to give feedback about that. And every jurisdiction is concerned about the ability of like people to be permitted and never to be inspected properly. So we all feel like we have the responsibility to inspect people if they're going to be in our jurisdiction. And we want
Because,
to
I mean,
have some
you're
control
checking
over that.
grills and
But,
every time they cook,
but the state legislature has,
and it wasn't
dictated that
effective
we
July
shall-
1st.
it goes into effect in 2027. So it gives the state time to figure out what that looks like. And so that's where we're on that committee. They meet, I think roughly monthly or something like that, but our inspector sits on that.
Okay, so we need a motion for the fines.
Yeah, so the
Yes.
motion's gonna be to have the miscellaneous fees and fines as it stands in this piece of paper, with the addition of, for every 5, there'll be additional fines. due to extra time needed for those extra violations that need to be re-inspected. We will then have another motion for what those fees will be, then we'll send that to the city.
Oh, we won't just include that in this.
We did it like the first one where we
Oh.
had we separated the fees from the
Oh,
proposal.
okay.
So. Anyone want a second? Motion for that?
Second.
All right, so let's vote on that. Ayes? I didn't know, so the ayes have it. So now the second motion will be to have those fees on those signs. Got $100 for each reinspection and above 5 to 9 would be $50. And then for every 5 violations above 5 would be $50.
Yeah, for every, increment or what,
Right? 0 to 5 would be free, I guess.
yeah,
You're covered
just
by-
the $100.
Just $100. And then for every 5.
It's additional
You get a
$50.
$50.
Yes.
Make sense?
Yep.
All right, so. Did I motion?
That was the motion.
That was a
That was
motion.
the motion. I got a second.
Second,
Yeah.
second.
All right, so let's vote on that. The ayes. And the no. Okay, the ayes passed this motion.
The most votes of any meeting. I think you,
I motion that I have most votes.
you'll be noted in the minutes.
This is a hot topic. I expect you all to be at city council on Monday.
Yeah,
It's
we're
just support
Be out
me.
of town, otherwise I would be there for you.
I'll be on the podium for about 45 minutes.
Are we able to move
Sure
on
whole
and,
hour.
and breeze through the last update?
Please, what do we have?
What else is there?
Yeah.
Yeah.
Yes, we want to get to.
No, I
the
can probably
tour.
be an email if needed.
Okay, Jen can,
That's good.
Jen can breeze through.
I can totally breeze through. We're expanding we're expanding appointment slots. It looks great. We're getting with PR to really push our travel vaccines once we move. We've only averaged about 17 a month for the past 3 months, and we want to do much more than that. Clinic utilization, our goal is 70%. We added LTBI patients to be seen in the FHD clinic in September. Up next, we will be launching titers, and then we're still exploring biometric screening and respiratory testing once we move into this new lovely home. And then quick updates. Our educator, obviously with schools back in session, she touches every single student K through 12 with the exception of 2nd grade in HSC schools. So she's busy right now. Looking at 2026, we're going to be launching some healthy aging education, partnering with the community center. We've had some great collaboration so far. We just wrapped up our Stepping On class cohort 2, and we actually have 20 people on the wait list already for the next class, which is not quite scheduled yet. So we're working on that. COVID vaccines have also been a hot topic. In just the 10 days that we were offering them, we've already administered 81. So lots of demand for COVID vaccines, which is great. We've shared a lot of best practices on the IDOH local health department calls. So our fall prevention team was highlighted. And then our hidden in plain sight vape room experience will be next week.
And we were
sharing
taking
across the state.
Dr. Cesana's recommendation because she said we had to compare.
Yeah. So we're sharing.
Yes, yes, we're doing.
You are doing.
You are
Yes.
doing the kids. Okay,
Mhm.
okay.
Yes.
Yeah. We have an open public health nurse position. We had a nurse that decided she wanted to move to Colorado and be in the mountains. So that is posted. That's also our school health liaison position. So actively recruiting for that. And then we're also working on hosting International Survivors of Suicide Loss Day, which is the Saturday before Thanksgiving. That'll be our second time hosting that. It's the only one in Hamilton County. We're collaborating with other partners across the county as well. But that's a nationwide event that is sponsored by American Foundation for Suicide Prevention.
My wife and I came in for flu with COVID. Staff was great.
Awesome.
Ann was great.
Oh,
Yeah.
and did mine too.
Yeah. No, she was very, very
Great, yeah.
educational. She
Yeah.
walked us through everything. So
Awesome. Thank you. We'll make sure to pass that on.
Yeah.
Thank you.
Very quick
Okay.
update.
Yep. So, give you an update on community health assessment. This graphic sort of shows you the 3 ways that we've gathered input. secondary data, that was the very large analysis that I've been doing over the last year. Our community survey that wrapped up towards the end of August, and I've seen those data and done kind of like the only one that likes this proportional weighting on it. But I just finished up my last of 7 focus groups this past Tuesday as well. And so each circle just represents priorities that have emerged from those 3 pending some further analysis on the survey data. But you can see where some overlap is shared across those 3 different sources. Mental health, this was particularly prevalent in the focus groups across the lifespan, but with particular emphasis on youth in early adulthood and aging adults. Social determinant of health came up a lot, whether it's through the secondary data I did. I have specific embedded measures in the survey to look at likelihood of financial insecurity, experiencing that across housing for others. And chronic disease prevention. Did I mention healthy aging?
You kind of rolled it into the mental health concerns of the aging.
Yeah, but you can just see sort of like where this alignment tells us that issues are both data driven and incorporates community voice and input, so community driven as well. From there is synthesizing this into a report to share with you, hopefully before Thanksgiving.
So not terribly surprising, but you can see what's risen to the top, and we're adjusting program and priorities, as you'll see, to focus on those things.
And then we are officially kicking off our FAB accreditation timeline. This is what we've talked about previously, Public Health Accreditation Board, to get this department accredited against national best practice. And in this quarter, we're doing our gap analysis. That's mainly myself, Jen, Laura, and then working with staff to assign out their ownership over different components. And first quarter next year, we'll be going through our documentation, because we do a lot of things and we do them well. We just don't document how well that we do them or how we could improve doing them, because we can't review them without the documentation. So, but that leads us to a point where we'll do our own internal mock readiness check quarter 3 next year, and then we'll submit for readiness. And based on that feedback, we'll either be able to go down the assessment process in 2027 and be accredited, potentially late 27, early 28, and then we'll rinse and repeat these cycles of CHOP, strategic planning, and FAB accreditation every 3 to 5 years.
Okay, last discussion point, then we can take a tour, I promise. So just looking for board support on these priorities. So we won't need to move next year, so that's off of there. So again, some of this is rising up out of our existing programming, but also adjusting topically to more chronic disease prevention focus, more healthy aging focus, more mental health focus, and more social determinants focus as a result of the different data points and collections that we've had as a result of the community health assessment process. So I wasn't intending to read these out loud, but if you want to suggest any adjustments to our priorities, I'd be happy to entertain those. Yes.
Legislatively, I know it's not a funding session. Is there anything on the radar? Because I'll be at the State House a lot.
That's a really good question. I don't have any idea about the special session and what might happen if that happens. But there's a lot of talk that could be positive for public health or very negative for public health. So I don't have any idea what to advocate for there, but thank you.
Well, I would add just what we already talked about, just continued storytelling. Yeah, that's just one thing you do, and just continue that message out in the community and just making that. I know it's kind of in the background, but if you write it down, it gives intentionality to it. Like it's so important. And you've got such a great platform in this space now.
Yeah.
My goodness.
Yeah.
Just thinking about what you can do with this and your message and just great storytelling in the next year can really drive a lot more of our citizens to healthy initiatives.
I love that. I will absolutely add that.
Short time.
Does anybody want to vote on it or?
Oh, yeah. Well,
I don't know. You don't have to. I'm just
wants to go down that.
I like the votes. It's fun when you guys vote.
One more vote. Until the mayor, he was.
Adjourn. Motion. Second. Aye.
Aye.
All right. Julia,
Okay.
you ready to go?
Tour time.
Thrilled to.
You want to